Well, we're going to get started. So thank you so much to everybody who has come on to this call from, a lot of you are from the region in Southern Ontario, but some other friends across the nation. I am going to ask everyone to just take a moment right now. If you are currently unmuted, just mute yourself and so that we can ensure that we don't have any background noise coming in or kids running through, um, which is pretty normal, but nonetheless, we want to just try to keep the noise interference as low as we can. We have various presenters who are going to be a part of the conversation on this call, and we welcome them to unmute as when they see an opportunity to jump in. But we want to get started. We've got a lot that we want to pack in this morning. And again, just thank you so much for taking a leap of faith and trusting this time to us so that we can have this very important conversation together. The purpose of this is honestly, it's to open up a dialogue, friends. You know the really well publicized phrase, Bell, let's talk. Well, this isn't associated with that, but I love the sentiment in there. Let's talk. Let's break the silence. Let's have a conversation. Here, I'm gonna open up on a personal level and break the silence and tell you, which I've never done publicly, about my own mental health journey that started in 2019. 2019 was a tremendously difficult year for me on multiple fronts. On the family front, with some HR employment matters, and things just kept stacking on to a point where I had to reach out for help. I had friends and colleagues that I could confide in who are on this call, but I still needed help beyond that. I could lean in on the Holy Spirit and God the Father because I'm a Christian, and I could ask God for reasons, but I still needed somebody to help me navigate through some of my stuff. And that's when I saw a registered psychotherapist in the region here who really, one of the biggest takeaways for me was that he normalized behavior. He said, Jeremy, if Jesus Christ himself went through some of the things that you went through, he would feel a similar burden of soul. The human body isn't designed to carry the things that you've been carrying in this last year. And so it's okay to feel some of the things you're feeling. And we're going to get you to a place where you can think through the things that you're feeling. But it's okay. Let's acknowledge that that's okay. So it was a normalizing of behavior. So today we want to let you know we are not going to be able to get into therapeutic models. You're not going to be able to get live counseling on this call and go away, but you're going to be able to go away feeling like, yes, it's okay to talk about this. Yes, you're going to take away some tidbits and resources from the speakers. And yes, you're going to receive a good resource list, bibliography of books and websites and resources and private counsel practices and public accesses that you can go after. Or you can put in the hands of people that you're leading if you're in a position of leadership. Okay, we're really excited about the speakers that we have this morning. Each of them comes with expertise from the respective fields, some as ministers of the gospel in churches, some as doctors, some as practitioners in mental health crisis units. And so, Zoom show of hands, clap, high five the screen as just a show of thanks to everybody who's come, including the speakers. So thank you so much. Now, I am really excited and honored to have my friend Ruth Ann Bright up. She is somebody who I have learned a lot from in this last year as it pertains to organizing events like this. And even on a pastoral care front, I've learned a lot from her in our conversations. And she's going to take us into the beginning of this session with giving an overview, a broad spectrum overview of mental health as she's seen it from her position as a pastor in a local church. So Ruth Ann, thank you. You have the floor.
Thank you, Jeremy. Thank you so much. To give more context to my pastoral ministry, I have served as Highview Community Church's senior pastor for the past 20 years. Recently, I have changed my focus to being Northern Thailand and working with at-risk and orphan children there. But during the time when I cannot travel there, it also happened that the current senior pastor at Highview needed to go on mat leave. So I'm also interning right now as the interim pastor at Highview. So all that to say, just to bring context, to lead a group of people, a community of faith during the pandemic really is a different experience than anything I've experienced before, specifically on the mental health front. As well, sort of in a parallel track, I'm completing my Master's of Divinity at Tyndale. I joke, it's taken me so long, I shall graduate should the Lord tarry. So we'll see what happens. But right now, my area of study is on preaching and leadership during disorienting times. And it's geared to this, specifically to the feet on the ground experience of pastoring during COVID-19. And like Jeremy, I want to come out and break the silence today and just let you know that I struggle from something called health anxiety. For me, it's vividly associated with 2 episodes of fainting that happened 12 months apart that kind of registered in my psyche as being, oh, that's a real bad thing that these 2 things happened 12 months apart only, both in public, both kind of a big hoo-hoo thing happening all around it. And the second time I was in Thailand. So it only heightened that sense of danger that I felt, or the threat for my well-being, because I was so far away from the Canadian health systems that I do trust, and just being so far away from home. And what health anxiety looks like for me is an overreaction to small bodily sensations that can send me kind of into hyperdrive really quickly. It can just send all those signals for fight or flight. They can be very mild symptoms like a little twinge in the gut, a little tightness in the chest. These days, on occasion, a little tickle in the throat, or anything that looks like I might be coming down with COVID. And all of a sudden, I'm kind of in this hyperdrive kind of space, to the point where it can be anywhere from being just mildly distracting to completely overwhelming. And I would not be able to carry on this conversation with you. I wouldn't be able to focus. I wouldn't be able to sit still. And for me, this doesn't happen all the time. Lots of times I can have all these little sensations happening and it doesn't trigger anything. But that's also part of the challenge for me, is that I'm not always sure when it's going to happen. And so there's that sort of not sure and uncertainty about that. So here I am telling all of you, and Anchor Ministerial Fellowship is called a fellowship for a reason. But some of you I don't even know. And it wouldn't at all be my intention, but I wonder if some of you might feel like me starting off like this is a little bit awkward or uncomfortable. And to be perfectly honest, even as I've been talking, I'm having this inner dialogue going, was this really an okay thing to do? Because usually we don't talk about it. Not personally, anyways. Professionally, in whatever professional or vocational area we serve in right now, we probably talk about other people's struggles. But for us to really admit our own, we don't talk about it. The seminars you already know, hosted by Anchor Ministerial Fellowship. That's a faith-based Christian organization. And I know that many of you here have an interest in the subject because we're caring for people in various faith settings. However, we've opened up this, this whole invitation for this particular Grow Day because we felt that it was an important priority for everyone. And we've set up the morning to benefit everyone, regardless of your faith system or your vocational setting. And everyone's been hearing so much about mental health these days. We're having a pandemic crisis that has stressed our health systems, our economy, and most of us who are involved in any kinds of people care at all, especially those and represented on our panel this morning who are in the mental health profession, are already talking about this rising curve, the surge of mental health crisis. And if you're not experiencing in any kind of mental health crisis in your vocational lives or your personal lives already, it's probably not a stretch of the imagination to say, brace yourselves because you will. Yes. Stephen Taylor is a psychologist, and he wrote a fairly comprehensive view that was released in 2019, and it's called The Psychology of Pandemics, Preparing for the Next Global Outbreak of Infectious Disease. Now, bear in mind, he released this in 2019, so that means he was writing it, obviously, a little bit ahead. And it's a little bit eerie to read. I've read it as part of my required reading for the course that I'm taking right now. But it's eerie because how close his predictions are on so many things. And about the mental health or psychological effects of the pandemic, this is what he has to say. He talks about the the fact that many people will actually be resilient and manage this okay, and they'll absorb it and they'll adjust. But he says this, however, during the next pandemic, now he's writing in 2019 or even before, during the next pandemic, many people will become fearful, some intensely so. And then here's the phrase, the psychological footprint will likely be larger than the medical footprint. That is, the psychological effects of the next pandemic will likely be more pronounced, more widespread, and longer lasting than the purely somatic or bodily effects of infections. Just think about how pronounced, how widespread, and how long lasting the pandemic has already been. And he's suggesting that the psychological effects are going to be more. And perhaps that's even an understatement of sorts, because the reality is that because of the stigma of mental health and for so many other reasons, we might not even find out how pronounced and widespread and long-lasting mental health issues are, because so many won't talk about it. They might not talk about it because they're not even identifying it in themselves. They know something's wrong, but they're not really identifying that this is a mental health issue. They might not want to talk about it because they don't want to admit it to themselves or admit it to others. Maybe their jobs or their vocation might be threatened. Maybe their family, they're afraid of what it would do for their family. They may not be wanting to reach out. They don't know who to reach out to. They may be afraid of the consequences of reaching out. And so we keep silent. We want to be part of breaking that silence. And so we've invited people with far more experience than I have to share with us in the panel. We have Ann Gillies, whose areas of expertise includes the area of trauma. Gail Patterson, who is a mental health therapist at Joseph Brant Hospital. Brad Wilton, who's a registered psychotherapist in Waterloo. Will Feenstra, a discipleship counselor at Crossways to Life. And Bart Campbell, who is a crisis triage worker at St. Joseph's Hospital in Hamilton, and most of them have other roles as well in caregiving and mental health. And all of whom are going to bring their wisdom and their expertise to our time together this morning. So thank you for being here. Thank you on behalf of those you work with and you serve, because this, we trust, will enrich you and equip you, and even as myself deal with my own issues, to make us stronger and more healthy by breaking the silence and being willing to even engage in this and addressing this huge hard thing that's really hard to talk about. So with that, I would like to hand it back to Jeremy, who's going to introduce even more broadly our panel, and we can move into that part of our morning together. Thank you.
Yeah, thank you so much, Ruth Ann. That's great. It just builds a little foundation for where are we going this morning. And I just want to run through a little bit of the timeline of what this looks like this morning. And so we have asked Dr. Ann Gillies to have like a presentation, a teaching moment. So we've got a good chunk of meat, of content to wrestle with and to think through. So she's going to present next. And then afterwards, we're going to take a little break. Take a stretch break, go to the washroom, grab another cup of coffee. Hallelujah. I love coffee. And then we're going to introduce the panel. We have 4 excellent panelists that we're gonna talk through with them. We're gonna have some conversations with them and tease out some thoughts and best practices and all sorts of things from the panel. And then we want to open it up to a little bit more free flow questions. Okay. And so I just want to mention on a technical perspective, go ahead anytime you have questions that pertain to Ann Gillies' discussion, type them out, send them in the chat, and that's going to come directly to me. And then I'll be able to sift through some of the questions, because we might find that there's a lot of overlap in the questions, and we don't want to plug up the chat because it can be distracting. And same thing with the panelists. As we're talking, put your questions into the chat. I'll be able to see them and pass them on to the panelists. Okay, so that's how we're going to moderate some of that. So without further ado, I'd love to introduce Ann Gillies. Dr. Ann Gillies is trained jointly in professional counseling and in theology, earning her PhD in attachment theory, complex trauma, and sexuality. Wow, you have studied. Ann has recently retired after 25 years of counseling, focused primarily on individuals struggling with complex traumatic stress. She is also an ordained pastor, an international speaker, an author, and founder of Restoring the Mosaic, which is a ministry which seeks to educate and inform politicians, community leaders, pastors, and more through conferences and seminars and workshops across Canada. Ann is among the ranks of one of my heroes, as she is an advocate for the heart of Canada and for the heart of this nation. And in many ways, I feel that many of us are indebted to people like Ann, who are champions, who are out there on the front line. So we are honored to have you this morning. So Ann, please engage this audience today.
It's wonderful to be here. Jeremy, that was very emotional for me. So yes, I'm going to be sharing a PowerPoint. I really, teaching is part of my gifting, which is good. Just to say that I retired because from counseling, because I saw another need that wasn't being met. And so I've been very, very diligent and very busy in the political sphere, who knew, and recently with Bill C-6. So that's been happening. So in the middle of COVID, no less. Now I'm going to try and share my screen. I've done this before, but give me a second to make sure I can get my PowerPoint up, and then I'm going to be with you. So if I just click on the whiteboard, right, Jeremy? Is that what I do? And then somehow put my PowerPoint on, which I need to find. On this screen, it's a little bit different. So I'm maybe having to exit full screen. Hopefully I won't do anything wrong here.
No problem. And if it doesn't work, I've got a backup for you and I can share it from here.
Yeah, I added a couple things. For some reason, what I'm seeing here is it's not, I'm trying to move it from my desktop onto the whiteboard, and it's not doing that. Is there a technique, Jeremy?
Yeah, sure. You don't need to use whiteboard at all. If you go to the bottom, in the middle, it says share screen.
Got it.
Click share screen, and then it gives you options, and look for the one that has your PowerPoint.
Okay, but my PowerPoint isn't there. Isn't that weird? Oh, okay. I'm using my husband's computer, so, oh my goodness, it's still not there. Okay, this is a little different than the last one I was doing. So how did I know that wasn't going to work? Okay, I've got my screen up. I don't want to take too long. Why don't you pull it up? I have added them. I switched some slides around a couple, so it may be a little bit
Okay. I'll bring it up for you on this end. If you're a good multitasker, shoot me an email and I'll put the new file up as we're presenting. How's that?
Well, it's not going to make that much difference. And I'm not sure. It's okay. It's okay. Thank you, Jeremy. Sorry about that. I've done it a few times before and it worked, and this time I couldn't figure that out. Okay, so thank you for bearing with me. We are in a mental health crisis. That's not really being spoken out very loudly, but we need to acknowledge it. the people who are on the front line certainly understand it and know it. And so you're going to be hearing from frontline people today that are going to give you some wonderful information. So my presentation is more on the education behind some of this. So we can go through these slides fairly quickly. And Jeremy, please, when my time is up, give me a 5-minute up, hands up or something, because I'm, kind of can talk too long too. So let's get started. And what I had changed that from in your church, is your church prepared, to are you prepared? Because each one of us is going to have to be able to identify some things within our own family even. We need to understand how people react to stress and those kind of things. So if you can change the slides fairly quickly, Jeremy, are you able to do that? Perfect. This is what we're dealing with a collective loss of the world as we knew it. The world we knew is gone forever. Now, you may be going, oh my goodness, how drastic is that statement? But I'm a realist. And what we are looking at is that the world we once knew will never return quite the way it was. And we have to start understanding to get our mind around those kind of thoughts, which is going to disturb us. It will disturb us. We will feel angst over that thought. And I don't want that to happen, but we have to go through the process in order to help others. And we need to be able to understand that all of us, and you can go ahead, Jeremy, all of us are going to be experiencing great losses. I'd actually move this to the end of the presentation, but this is fine here. This is what the Lord says to you. And I want to remind you that for those of us who are believers, we, in the midst of crisis, this is our time to shine Jesus. And remember that he is with us. Do not fear, for I've redeemed you. I've called you by name. You are mine. When you pass through the waters. So we have passed through many waters, all of us. And now we're going to pass through some other ones. When you pass through the waters, I will be with you. And when you pass through the rivers, they will not sweep over you. When you walk through the fire, you will not be burned. The flames will not set you ablaze, for I am the Lord your God, the Holy One of Israel, your Savior. How good it is to hear the word of the Lord this morning. Go ahead, Jeremy. So we are living in a contagion of fear, and I'm going to be talking mostly today about the worried well. And what I mean by that is those who do not have significant, and I'll use that word, significant mental health issues, diagnosed mental health issues already. So the most of us in Canada would come under that category of the worried well. And what's happening though is the worried well have become incredibly fearful. And that's happened a lot because there's a one-sided focus in mainstream media that's creating a contagion of fear. You just watch the news every single month or every single night for the last 9 months. And what do you get? It's like after 9/11, the repetition, and it creates this contagion. The focus is on reducing the risk of infection and death from one disease, which is important, but it's to the exclusion of all other health risks or life concerns, which we're going to see. Go ahead, Jeremy. Sorry, I don't have this to do myself. I'm very sorry about this. So what we are in Canada and across the world encountering is grief. So that's just the easiest diagnosis I can put on it. We are all grieving from loss, suffering from the loss due to the lockdowns. And I will say to the lockdowns, there's loss due to COVID-19, but most of you, and I would say most of you, and I want to be careful here, have not actually lost someone to COVID-19. Many of you may have had diagnoses. Many have you had friends who have contracted COVID-19. A few may have been hospitalized, but very few have actually died from the COVID itself. But the losses, the overwhelming losses from the lockdowns and, of course, from those who have experienced COVID is going to be staggering. Go ahead, Jeremy. And that's what Ruth Ann was talking about. So what is grief? Grief's the normal and natural emotional reaction to loss or change of any kind. So what we have to understand, and Jeremy was talking about this earlier, that the things we experience in life, the emotional experiences we have due to crisis are normal and natural. It's when we can't bounce back that it becomes more of a mental health issue. And grief is also the conflicting feelings caused by the end of or change in familiar patterns of behavior. So every one of us has an element of some kind of grieving right now. So we're all in the same boat. We're on this ocean together, if you want to say that. We're all grieving the loss of face-to-face time with our friends and family and touch. Have you noticed, I'm sure you have, that there's such a heartache because we can't touch those we love, our children, our grandchildren, our siblings. I don't have any, but I have some adopted siblings. Friends, we can't get together. Our extended family members. So for us and for many of you, I'm sure all of you, we've missed Easter. We've missed our summer reunion with family. We have a big, not my family, but my husband's family is a huge family. And we always get together in the summer at our house. I'm missing all of those gatherings. And now we've missed Thanksgiving and Christmas. So it's a grieving time. And for us in the family of God, we miss our church family. Do you know what I miss the most about our church family is being able to pray, to hold someone's hand and to pray for them at the end of a service, because we always have an opportunity for that. So we have a lot of grieving going on. We miss things. We have losses happening just in the normal, everyday kind of process of the lockdowns. Jeremy? So when we talk about grief, there's a thing, and I actually had corrected disenfranchised. I spelled that wrong. There's a couple other things here I noticed this morning going through. So disenfranchised grief is the grief that's not acknowledged. Now, I want to say that all of you being on this meeting today are acknowledging that there is a crisis. And so that will help those who feel disenfranchised grief, because you are going to understand and come away with this understanding that everyone is suffering at some level. You probably already know that. There are others that have mental health diagnoses that are greatly suffering. If it's bad for the worried well, it's horrific for those who have mental illness issues. So grief that's not acknowledged, loss that is not recognized, grievers who are not acknowledged. So sometimes those who are grieving and sad, and it's like, we don't want to deal with it, it's like, oh, come on, get over it. But we need to understand that they need to be acknowledged. The unemployed, lonely seniors, children, all of those that have disenfranchised grief. So if we go forward now, we're going to talk a little bit more of that and talk about this grief ball. So many of you may have seen this. I used to use this all the time. I loved this grief ball. And for children, I would have them color in different colors, some of the emotion they were feeling. And they loved to do this. And I give them several balls paper, to take home with them, so that on different days they could actually color in what they were feeling that day, and didn't have to talk about it, because sometimes they don't want to talk. But it's good for adults just to understand some of the things you may be experiencing right now. Deep loneliness, sometimes panic, apathy, fear, pain, all kinds of things. And it feels like we're in a fog. It really feels for people like they're in a fog. So we want to be as healthy as we can be, so we can help those who are experiencing deep emotions. Go ahead, Jeremy. So let's talk a little bit. I want to talk about the collateral damage. I kind of touched on that, but what we're seeing, and I would think, Gail, you maybe have some information on this as well, working in the hospital, and so will Bart. But there's a lot of collateral damage. There's delayed and interrupted healthcare due to the lockdowns, and doctors are fearing a tsunami of cancer diagnoses after the lockdowns are lifted, because people have there's been kind of a halt in some of the testing. So there's also extensive unemployment, loneliness, increased domestic abuse, increased child abuse, deteriorating mental health, anxiety, depression, suicidality. And just to mention, suicide ideation is up in Canada by 8% this year, last year. 2020, 8%, it's risen 8%. That's not the amount of people committing suicide, that's the amount of people thinking about it. And when it becomes pervasive and they begin to plan, then we have some problems. So we need to be in touch with people, we need to be talking to them. Increased opioid crisis and deaths, tremendous. That has really escalated, especially in Vancouver. Increased addictions of all kinds, and I did actually correct pain. It's not pan. We feed our pain. All of us do that. So eating disorders, all kinds of things can start happening. But there's a strong relationship between economic recession and public health. And what we're going to see, we haven't seen nothing yet. So there's the bad news. We are just on the cusp of beginning to see what's going to happen down the road in 2021. Go ahead, Jeremy. So with the collateral damage, we need to be checking constantly on the children. The disruption of their lives has been phenomenal. It's just been so horrific. Wearing masks, not being able to read expressions, especially for the youngest children, because children interact with facial expression and all of those things, and it's really, really difficult. They have a disruption in their daily routines, so keep the routines as regular as possible. School, exercise, social interactions, family routines. There's a record number of eating disorders that our Sick Kids Hospital is talking about. Sleep disorders, worry, and high anxiety you may feel and find in the children. Fear is the root, actually, of all of that. Fear is the root for all of us. And to begin to talk about the fear that creates all of the anxiety and worry and grief is going to be important. Irritability, sadness, all kinds of things affecting our children. And in January this year, Sick Kids said that children should be in school because it's more important for them to be in school, and that children under 10 transmit the virus far less than adults. In fact, children themselves have a far less chance of contracting COVID than adults do. And yes, they could go home and give it to their parents. All of those contacts could be bad, but we have to look at the long-term devastation as well. Can we go forward, Jeremy? We also need to be checking up on the business owners and the unemployed. These are really the disenfranchised people right now, because most of them are silently, at home or trying to figure out how to work from home if they can, but many can't do that. The older workers actually suffer longer from joblessness, so recognizing that, and the association between unemployment and poor health, which I mentioned previously. Major affective disorders, chronic physical health problems, early death, and suicidality. Again, those are the things that are going to start to escalate. So we really want to be somehow on the front lines, understanding these things. Go ahead, Jeremy. So checking on the seniors. My mom is a senior. She's 86. She's been with us now for a couple of weeks. She likes her home and she wants to stay at home. But we just, since last year, we've been bringing her down and staying with us for a couple of weeks at a time, and then she'll go home for a week because my mom also struggles with mental health issues and paranoia and schizophrenia. And so if she is alone too long, those things begin to surface. So you can imagine for other people who aren't having someone come and take them out and be with family. So living alone, isolation, loneliness, sorrow and grief, again, the depression, and for them it becomes overwhelming. Who do they talk to? And remember our seniors, and I'm a senior, so here we go. But our elderly, I'll say, because I don't feel elderly, but our elderly are not always very good at sharing their emotions. So sometimes we have to just take a lot of time to get that out of them. And it's difficult. Depression, increased mental health issues, and a lack of attention to their physical health problems, especially now because they don't want to go to the hospitals. Because what if they catch a virus or something? There's so much fear. And so even if they're really, really sick, they don't want to go to the hospital, or they don't want to, you can't see a doctor right now anyway. So it's very difficult for our elderly. And then if we go on, keep going, Jeremy. We are, I think we need to recognize the historical trauma that will start to generate now, past 2021 for sure. So historical trauma happens when events are so widespread that they affect an entire culture. And for us, of course, they've infected and affected the whole world. The events then are so intense that they influence generations that did not experience them. So even though our children, even our younger children, are experiencing the effects of lockdowns and of this constant fear that's happening, it will be their children that will still suffer some vicarious trauma, generational trauma, dependent on how we deal with fear now. Dependent on how we deal with fear now. And it is important we deal with fear. Can you go forward, Jeremy? I'm not sure what my time is. Let me just check. I'm running low, but I want to touch on these things. Now, I know that for most of you, you're thinking, well, where are you going here? Because traumatic stress has affected a lot of people in the past. And so I would just want to touch on those who have post-traumatic stress disorder or complex traumatic stress. So those people who have had significant either wartime trauma or childhood trauma that has affected their current mental health. That past stuff will begin to surface anew if it has not been dealt with. So there could be, certainly will be, an upsurge in acute post-traumatic stress that you see, emotional reactions to events that are happening, and that lasts up to about 30 days. And then the diagnosis of PTSD has to be over 30 days. And I can't go into all those symptoms. I do whole teachings on this, but keep going, Jeremy. I have some good resources that I will give to you. So just to give you some 3 major symptoms that you may see in people, and very quickly, they will experience some of the aspects of the original traumatic event. So you may begin to hear them talking about things that happened 20, 30, 40 years ago. And for the elderly, 70 years ago. And they begin almost talking about it like it's happening right there in the moment. They are re-experiencing it. Or they may avoid symptoms that include attempts to avoid the triggering locations and people. And if isolation is a triggering thing, then that's a big problem for people right now. And then hyperarousal symptoms that include being constantly on high alert for danger. You will see this in people who have experienced past significant traumas. Now I'm talking about major traumatic events. So, and they are more likely to be irritable, They have angry outbursts, and incredible sleep disturbance. Sleep disturbance right now is a big thing right across the board. But for these individuals, it's very ongoing. If you can go forward then, Jeremy, I'm almost done, folks. There's so many things we could be talking about, but let me just talk about some emotional reactions you could experience or those around you could be experiencing. Increased anxiety. I'm harping on the same things, but sometimes we need the repetition. Grief, denial that they're really experiencing the emotional intensity that they are. Some panic, depression, fear, loss of emotional control. That's really a scary thing for people, for sure. Intense anger, being overwhelmed, and again, irritability and unusual agitation. So those people, and I'm talking here more about those who have PTSD from the past. So those are kind of the normative things that they go through, and add lockdowns on top of that. So it's going to be an incredible year in Canada. Can you keep going, please? I think we'll just go through, maybe just quickly, the physical symptoms of PTSD. And you may be feeling these now in response to the fear that we have come in under with COVID. So fatigue, nausea, some physical symptoms, chest pains that we feel, our heartache, heart murmurs, and heart attacks. We can have all kinds of physical things happening. So be aware when and if you have some of these indications, take care of yourself, talk to someone, rule out the physical for sure, but remember that mentally there can be a lot of things going on. Jeremy, you're going to have to go through the slides quite quickly now. I'll just, you will have these slides, so keep going, Jeremy. We'll just keep going because you'll have access to these slides. This is a comorbidity of all kinds of other things that can be happening when you have PTSD and other psychiatric disorders. Some of you will be familiar with these kind of comorbid indicators. So these are a lot of things, mental health issues that we might just see surfacing in a big way in 2021. Continue, Jeremy. Spiritual reactions. So people, this is a time to keep close to God, to draw in, because what you're going to find is this sense of hopelessness for individuals, especially those around us out in the world who do not have a center for their hope. We question our purpose, lots of anger toward God. How could you let this happen? How come my children and our children? Now we have this universal children at home, but we have all of these things. So our foundations are being shaken. Let's make sure that we have our foundation on the rock. So can we go forward? These are just a couple things I want to add at the end of this presentation for the very simplest way to help people. It's just to remember these things. So remember that God is the God of all comfort. And 1 Corinthians 1:3 is such a beautiful portion of scripture. Read it often. Read it often. I want to talk to you about developing rapport with individuals who come to you, whether it's on the phone, via Zoom, internet, however they do that, or even if you're in the hospital setting and it's one-to-one, that you must develop rapport with those people and even your relatives. Again, keep doing it. It's all about relationship. If we want to see safety and stabilization from the fear and panic that has overtaken our nation, we must be intentional about relationship. We must be intentional with those that we know. We must be a safe person for individuals to come to. It's all about relationship. It's all about trust. And we must remain that safe person. It's all about consistency. So those are just a couple of the things that, just to remind you, okay, it's all about relationship. Wait a minute, with this person, it's all about trust. that they can trust me. And then it's all about consistency. If we are going to enter into helping people overcome the fear. Can you go on, Jeremy? We just have a couple more slides. Thanks for bearing with me. I want to talk just quickly about the God relationship, the attachment relationship we can have with God, and that we can help others enter into that dimension of relationship with our Father, the God who heals our deepest wounds, who comes near us in our anxiety, who satisfies our deepest longings. And there's so much longing and disappointment now that's happened for every generation in COVID, from the very youngest to the teens, to the university, to the workers in the workforce, and to the seniors. So many, many longings. But God gives security in Him. Trust Him, lean on Him. You know, this week I was in another Zoom and I felt God just really say this to me, that we are swimming in the ocean. We must learn to swim in the ocean, because we're literally swimming in an ocean of fear in Canada. And how do we swim in that and stay above water? Oh, we hang on to the rock. We hang on to the one who's reaching out his hand to pull us up. I always think of that image with Peter walking on the water. He is the God of all comfort. And I'm getting a little preachy here, but if you want to go to, I think this is the last slide. And I'm not sure, Jeremy, if I added this. Yes, but we need to be purveyors of hope. That means we have to stay in hope ourselves. We need to think on the things that bring life to us. I love Philippians 4:8. In fact, 4 to 8, all of those scriptures. And you can say, well, how can we rejoice in all things? We will rejoice in Jesus, our Savior. We rejoice that He is here for us. And so thinking about the thoughts that will bring us out of the mental state that we can get ourselves in duress and fear, and we desperately need to press into God. He has not given us a spirit of fear, but of love, power, and soundness of mind. Now, just before I finish, I want to refer you to a website, and Jeremy's going to put that website in the chat. And it is from the Billy Graham organization. I still work with them as a chaplain and a chaplain coordinator into disaster areas. And I've taught this course on sharing hope in crisis many times. It is available free if you go to their website. And I don't know how long, I haven't watched this one, but it's sharing hope in COVID as well. So it's very up to date. And it is probably the best information that you will be able to glean. So there you go. Thank you for listening. And I look forward to listening to the panel and hearing what they have to say.
Right on. Thank you so much, Anne. It's so good to learn from someone like yourself. I've just put the link that you referenced in the chat. There's just, again, there is so much that we can learn. There is so much that we can discuss. We've had some excellent questions start coming in on the chat, so thank you for that. Some very honest and transparent questions. People who want to make some direct connections with our speakers, and so we thank you for that as well, and we'll do what we can to facilitate. Yes, we will send out some resources after the call, and maybe this afternoon or into tomorrow if we need to finish some things up. But again, thank you so much, Anne. What we're going to do now is take a 5-minute break, just to stretch, use the washroom, and then come back. And now we're going to get, not that Anne's presentation wasn't practical, but we're going to get even more practical with some additional real frontline workers like Anne, but who are battling it out in the trenches daily right now. And so it's about to get real. It's about to get personal. We'll see you all in about 5 minutes. All right, welcome back, everyone. I just got to say, this is pretty awesome. We have 85 participants on the line. So that's great. I think that may be a record for a Grow Day. So thank you again so much for taking time to join us on this call. That's pretty awesome. Well, I want to just start out. I'm going to share screen for just a quick moment and show you an article that was brought to my attention the other day. 4 million cries for help. Calls to the kids' help phone soar amid pandemic. So this is a very practical headline. It's not meant for me to incite fear in you. We've talked about all sorts of things. We have no intention of becoming political or suggesting whether schools should open or close or any of that stuff. But we have very practical things emerging during this pandemic. I've got 4 teenage kids at home that I'm dealing with while trying to maintain my job as a CEO in one organization and CAO with this organization, Anchor. And that's why I invested in noise canceling headphones. That would be, for me, a coping mechanism. Everybody's got means and ways of trying to balance. And we have some men and some women who are about to share with us. And we're gonna, like I said, we're gonna get real. We're gonna get nitty gritty now. We wanna hear from frontline workers who have some insights to share with us. So first, I'm gonna invite one of my lifelong friends, Mr. Brad Wilton, to give an introduction of himself. Brad?
Good morning, everybody. It's great to be here. My name is Brad Wilton. Thanks, Jer. I am a registered psychotherapist here in Ontario. I live in Waterloo, and my company is called Upstream Counseling. And I'm a relationship guy. I have been working for 15 years or so now, and I've really found over the years that the more I talk to people, the more I just keep finding myself honing in more and more on relationships and connection. And so these days when people are asking about counseling or maybe going to therapy, the real goal here, as far as I'm concerned, as far as the work that I try to do, is to help people connect more deeply with themselves and with each other so that they can have deeper, more authentic relationships. I really think that's the goal. And I think that connects with everything we've been hearing so far this morning. And so I'm looking forward to this discussion.
Right on. Well, I'm so glad to have you on here, Brad. I've been the recipient of many free therapy sessions in the hot tub out back, so thank you for joining us as a professional this morning. Gail Patterson, would you introduce yourself?
Yes, hi. I am Gail Patterson. I live in Burlington, Ontario, but I do have my MSW from Wilfrid Laurier. I lived there for 30 years, so Waterloo is close to my heart. I work in community at the Community Mental Health Center and outpatient mental health at Joe Brand Hospital. So I'm now there 2 days a week. We are just doing it remotely, of course, but dealing with people every day who, you know, at one point were probably doing a lot better than they are now. So, you know, digging into that every day with patients at the hospital. I also have a private practice called Bridgework Integrative Therapy that I do in Burlington. I also have my registered restorative yoga teacher training as well. And I'm starting to combine that with talk therapy, and finding it makes a really great combination for people who don't have any restoration time. I mean, I think that's the biggest thing for us right now, is that we just don't have any recovery time. And so trying to create that for myself and for also for other people. I always share that I also suffer from a level of depression and anxiety for which I take medication. I think it's important for us as mental health professionals not to pretend that we have it all figured out. And so I'm always very open with patients and clients about that. I live by Joshua 1:9. Have I not commanded you? I say it every day, several times a day. I'm really happy to be here, though, today to just help break this silence. And I'm happy to answer the questions that we're going to have this morning. So thank you for including me in this.
Thank you so much. And I hope you get a sense, everyone, that every one of us, we're just real folks on this call. We're as transparent as we can be, and we want to talk. And so next, I'm going to invite my friend Will Feenstra to introduce himself.
Hi, everyone. Thanks, Jeremy. I've been working with youth for almost 20 years now. It's hard to imagine that it's been this long, but I have a passion to work with youth and to see them flourish. And I've had different fields of opportunity to work with them. And I honestly consider it a privilege and an honor, and touched on the trust. It is huge that, and I said this to a client yesterday, you invite me and to trust me to open up and share. And so in the different fields, I worked with youth in the community for quite a number of years. and also worked with youth full-time on a ranch. That was quite an experience, working with 3 teenage boys for over a year, and physically side by side, walking them through and sometimes working them through different things. I worked with youth in a leader position, also as an assistant youth pastor for many years, and currently I get to work at Crossways to Life, where I'm a discipleship counselor. And the big part there is that I fully acknowledge and explain to every one of my clients that I am the discipleship counselor. The Holy Spirit is the counselor. And so we work together to unpack history, and walked with quite a number of people struggling with anxiety and depression and suicide, and to walk them towards true healing, and yeah, just to bring hope. And so I'm excited about today to bring hope to a struggling world.
Thank you, Will. And Bart Campbell is joining us, I think, from the Hamilton region. He is one of our Anchor members and is very much on the front lines. Why don't you introduce yourself, Bart, and then we're going to get this conversation started.
My name is Bart Campbell. I am presently working at COAST, St. Joe's Hospital. COAST stands for Crisis Outreach and Support. Well, my specific job is that I triage suicidal calls or crisis calls, of which we receive 40 to 50,000 a year. Of that, probably between 35 and 50% are suicidal. And my job specifically is to calm the situation, get the support that people need, and possibly make referrals to the community to get the therapy and support that people need. I am also assistant director of Agora Ministries, and Agora Ministries is mission is to teach the church, to equip the church in regards to mental health. So that's basically who I am. I've also, worked in crisis for over 20 years.
Wow. I have a lot to learn from you, from all of these panelists. So Bart, let's dig in. I want to ask you to help me get this conversation started, okay? Because as we discussed the other day, I realized real quickly, I'm like, wow, you got a lot of great things to add. So you're a mental health worker, a crisis worker, serving on the front lines here in Southern Ontario. Paint a picture for me. We've already started some of this, but paint a picture. What is happening out there in general? In your practice, what are you seeing?
Well,
is this pandemic affecting anyone? Come on.
Well, there's been a shift from the calls that we get. People that we've never heard from before are calling on a much more regular basis. People that are really struggling with the isolation, lack of supports. When I say lack of supports, a lot of people that have, their everyday supports are no longer available. When we're talking about being, socialization, talking to people, attending groups, attending church, connecting with people, if somebody has a mental health diagnosis that is to see a therapist or to exercise or whatever, a lot of those things are no longer available. We have received a lot of calls from people over the age of 50, not knowing what to do, that are not tech savvy. I'm isolated, I'm fearful, I feel like I'm going to end my life. There's no reason to live. Where do I go? What do I do? And they're really searching for hope. Interesting enough, I received a call 2 weeks ago from a person that said, I am so angry at my church. We have been in the midst of this pandemic and nobody has reached out to me. I have functioned, at various levels within the church, but nobody is checking on me, which leads to, a lot of questions. I really appreciate everything that Ann shared. How prepared are we for what is to come? We're just seeing the tip of the iceberg. We're going to see so much fallout from everything that we're experiencing. The frontline workers, post-traumatic stress disorder, anxiety, job loss, abuse, addictions, it's across the board. How is this going to impact our children who should be in school, socializing, who are now, attached to their instruments, their game board, everything, computers. We're seeing a rise in addiction to electronics and gaming. So we're only seeing a tip of the iceberg. So for me, it is how prepared are we? How prepared is the church for what's to come? Saying that, have we checked our own mental health, our own strategies? Because the fact of the matter is, we're helping people deal with COVID, but we forget that we're dealing with COVID. And we're dealing with our family in COVID, our own losses in our own situations, right? So we need to really look at ourselves and how prepared are we for what's, even as pastors, right? We're doing church much differently, right? We talk about returning to what was the old norm. We're not returning there. We now have a new norm. What does that new norm look like? I couldn't imagine being in a huge facility and wondering, how are we going to continue to support the facility, right? It's so multifaceted. And, I think it begs for a deeper conversation. So, we just need to be aware.
Yeah, and I put your quote there in the chat. It said, have we as leaders checked our own mental health? And I appreciate somebody right away wrote back one word: constantly. I thank you for that. We have to do that. We have to be aware. And so this doesn't just affect the church. This is affecting all of society, ourselves included. Yeah. So Gail, in our discussions last week, you brought up something that really got me thinking. You highlighted that people in society were dealing with their own mental health issues prior to the pandemic. So talk to me. What does this look like in society right now? What are you seeing at St. Joe's?
I think what's so interesting is, to Bart's point, this is the first time, certainly that I remember, that as mental health professionals, we are dealing with the very same thing that our patients and clients are dealing with. So there's these layers, there's this kind of historical layer. So childhood and potential childhood trauma and, kind of whatever we grew up with. And then there's sort of the what's happening now, that those two regular layers that we all just sort of are dealing with and moving, back and forth between in our lives and just working and all of the day-to-day stuff. And then add on top of that, these two other layers. So now we've got this layer of fear about this disease, this disorder, this, whatever you want to call it, this infection. And however much we might be following protocols and protecting ourselves, that fear is there for everyone. And then add on top of that, so now we've got 4 layers, the top layer being just the isolation, right? Just the sheer isolation, which is, and again, this is affecting all of us. So now as mental health professionals, what my colleagues and I find is, first of all, dealing with our own issues around that and trying to keep ourselves, as Bart said, okay, checking in with ourselves, and having people in our lives who we can connect with in different ways, and oftentimes that's each other. But then dealing with people who we're not even getting now to the first 2 layers anymore, right? The first 2 layers are affecting and driving how people are reacting to this pandemic. But at the same time, there just isn't enough time and energy to continue digging deeper, which is what we generally do in psychotherapy. It's about doing some fairly deep digging and helping people reframe and begin to learn skills to help them manage. And wow. So, the work is harder. We are there every day at the hospital. We are doing it remotely, but we're still digging into it every single day and trying to take care of ourselves, but also trying to help patients just navigate. And we really talk a lot about, we're just all treading water right now. Like, we are just all treading water. And what I try to teach patients to do is sometimes just turn over in the water and float for a bit. Just, instead of fighting constantly to stay above water, how about we just spend some time just floating, right? Just let the water hold us up, because we've got a lot more treading to do, right? We just really do have a lot more treading to do. So
Yeah.
yeah, people that are normally fairly well aren't as well. So again, the worried well are not so well anymore. The people who were really struggling are struggling even more because they now have these two layers on top of whatever else was going on for them.
Yeah, and you made a profound statement in our panelist discussion leading up to this. You said we had a pandemic and an epidemic long before COVID. And that epidemic is mental health. Can you unpack that? Like, what does that?
You know, I mean, we all have a human brain, and the human brain has a built-in negativity bias. I mean, it is about survival and evolution. That is the whole point of the reptilian part of our brain is just to keep us alive. And when we lived in caves and we had saber-toothed tigers around, our brain would do what it needed to do to put us into fight or flight so that we could fight that thing or kill it and drag it home for dinner. And then we would go back into rest and digest, which is where we're supposed to be most of the time. And this is about the nervous system and how the nervous system in the human body works. And so I often say, and I've said for a long time, it's like we have Fred Flintstone bodies in a George Jetson world. Our bodies, our nervous system, our brains are just not meant to keep up with having a saber-toothed tiger around every single corner. Right? And now we have this saber-toothed tiger with a big umbrella over all of us, and it's called COVID, right? So our brain is just trying to keep up. Our brains are just trying to keep up, and it's hard. So the pandemic we had before was depression and anxiety going into this. Right? For most people, some level of suboptimal mood, some level of anxiety may not be clinical. We don't want to pathologize every moment of anxiety or every moment of sadness, but for a lot of people, it does become pathologic. And now we're dealing with it as counselors and as physicians and as psychiatrists. The psychiatrists that I work with at Jill Brandt are just to the wall trying to help people be okay, right?
Yeah. Well, and that's the thing. It's affecting all aspects of society, including frontline workers, especially frontline workers. And now I want to narrow down the focus. Let's talk about parents. Okay. Many of you are parents or grandparents on this call. And Will Feenstra, you've been working for decades with teenagers. Well, brother, I need some help. Okay. I've got a 12-year-old over there and a 14-year-old over there and two 17-year-olds who are still sleeping. Oh no, one went to work really early because she now got a job. Look, I know we've got the lockdown, but I fear I'm headed for a throwdown. That's my quote leading into this, kind of for fun. But how do you address the outward behaviors? Often we address the outward behaviors rather than what's happening inside. Talk to us practically on that level.
Jeremy, that's such a common question that I get asked. I get a lot of calls from moms. And two things, they're worried about what they're seeing and they're scared about what they're not seeing. Kids nowadays are hiding behind their phones in their bedrooms with the doors locked. And one of the many things that I've learned sitting one-on-one with people that are struggling is there's such a strong connection between what's going on the inside and what the outward expression is. And oftentimes the outward behavior is just a cry for attention. Notice me, love me. I have a vice principal living next door, and she said what they're seeing now in school is this total depression. There's just the kids are walking in straight lines. They're following all the rules and all the guidelines, but there's no expression at all anymore. And so they've gone up and they've put up these masks, and they're just hiding behind there's this pain on the inside, but they're putting up a mask because they have to pretend, because they're not allowed to express. And so what we're seeing and what you're seeing in the kids is an outward expression of some inward struggle that's going on. Before I became a parent and when I first had kids, people would tell me, you have to distinguish between the different cries. And I'm like, what are you talking about? Well, there's the hungry cry, there's the thirsty cry, there's the I got a dirty diaper cry, there's the I'm tired cry. And I think what I get to do is sit with these young people and find out what is the cry. What is really going on? Because if a baby has a dirty diaper, you can put them to bed and try to get some sleep, but it just won't work. And so for me, what I get to do is unpack, and it's been mentioned many times now already, there is an underlying issue that happened in the past that is affecting how they think today. and they respond not out of what's going on today. Today, what's going on is bringing to light a struggle that happened a long time ago. So the first thing I get to do is build trust with them. And I've mentioned you before, Jeremy, I love the quote from John Lynch that he talks about trusting, and love can only be received to the degree in which you trust someone. And just yesterday, I met with a young person, and she says, I can't trust anyone. I've got no one to confide in. I got no one to talk to. And so all this stuff is now stored inside. And that is what now comes up. And what we're going through right now is everything is just being compressed even more. And so now people they can't hide behind the masks anymore because they're blurting out in some sort of behavioral pattern. And for every child, it's different. The one blurts out and won't stop talking, and the other one shuts down completely and won't say a word, and you can't get them out of their room. So the one is up all night because they're not physically tired because they haven't done anything, but mentally in their mind, the stuff is going crazy. And that's where a lot of the anxiety builds. I did something stupid today. I must be stupid. And that's one of the things that's going on right now. The negative person thinks that way. The critical person thinks that person did something stupid, so they must be stupid. Right. And so now you've got an internal battle going on that we need to have patience. I love how Anne said the consistency. We need to build relationships. We need to be trusted and trustworthy and consistently give them opportunity to unload. So that's what I got to do with this young lady yesterday. Give her an opportunity, a safe place to just dump. And I said to her, I said, I don't care how messy you make this table. Throw it all up. Just let's get it all out there, and then we can piece through it. And I'll let you know you're not alone. You're not alone in this. Let's just talk. I've got my struggles. You've got your struggles. Let's be real. And that's, I think we need to be real with people. And that's what I love. I get to do with these young people is just be real with them.
Wow. Wow. And I'm just sticking in the chat here a response like, here's a real comment. As a corrections officer in a male youth prison, I see this all the time. Young boys who are literally not allowed to express themselves for fear of being jumped, for fear of being weak. They're so scared they act out. And so they start to see all of these things manifesting in their lives because of these fears. And then the false narrative, the beliefs that they start to think about themselves, and then it spills out in these behaviors. And so I think it's a great opportunity to talk to Brad Wilton for a bit. Like, again, I mentioned this at the beginning of the seminar about the concept of normalizing behavior. Now, I'm not saying that we're condoning behavior or poor behaviors or choices in my own life, but sometimes it's good to get to the root and start to understand why I do what I do, right? The Apostle Paul talked about that in the Bible. Why do I do what I don't want to do? What I do, I don't do. And he was struggling with some of these thoughts then. And so, Brad, I've been the recipient of lots of great candid conversations. And one of the things that you talk about is weakness and shame and the interplay that you see with a lot of people who come to you. Can you talk to us about that?
Sure. Yeah. So a lot of people, I'm persuaded a lot of people are in pain and they confuse it for weakness. And then that leads to shame. And that takes us to a dark place. And so on a basic level, the piece here is we have to notice that pain is pain is a problem. It's not weakness. If we can deal with the pain, then we can find our strength. And so as Gail and Bart and everyone have been saying, like, we're all sitting here, we're 11 months into a pandemic and everyone has a hard life to begin with, and now we're all chronically isolated and everyone's running on empty. And like, I'm grouchy because I don't like January and it's cold and dark and I'm just waiting for spring. And when your tank is empty, it's important to notice that doesn't mean you're broken. It just means you need to get your tank filled up again. And so the cognitive reframe, if you want to put it in counselor terms, is we need to notice that the current circumstances we're in is not who you are. It's not intrinsic to your identity. It's an experience we're having, and we're having it all together. And so we need to connect with each other. We need to connect with our faith. We need to connect with anything that's going to help us deal with the pain so that we can feel strong again. and begin to move forward and be more confident.
Yeah. Well, and Gail, you referenced generations of us were raised on shame. Look, I know from the background and the very conservative theological persuasion of my family, and the roots that I came from, shame was much more celebrated over grace. It wasn't spoken that way, but it was functional that way. How does that impact people in today's situation?
I mean, I think, honestly, I don't think parents meant to shame us and shut us down. I think they meant to motivate us to do better. But what we know about shame from all of the recent research is that, in fact, it does just shut us down. It does not motivate us to do better. And I love when I'm with people and we talk about shame and guilt, and they'll talk about feeling guilty about something. And I'll say, you know what your guilt is? And they kind of look at me like, what? Like as if it's going to be something bad. And I will say, your capacity for guilt is your evidence you're a good person. And they just they sit up a little bit straighter. They kind of, so instead of having guilt be this thing that drags us down, because it doesn't feel like fun. There's no question it's not a fun feeling. But what it tells them is that, okay, if I'm coming, I'll say, you have now hard evidence you're a good person. So I'm not a good person, I'm weak, I'm, whatever words you've grown up sort of believing about yourself, you now have hard evidence that that's not maybe true, right? And so to begin to build from there. And that, that it takes incredible courage and strength to carry this weight for so long, and to walk into somebody's office whom you've never met before, and this is kind of what Will was talking about a little bit, and sort of dump all your junk. I mean, if that doesn't take courage, I don't know what does. To walk into an office and say, wow, this is my stuff, help me unpack it, right? And to be a compassionate witness to that is really, for me, the gift of the job. The gift of the work is to be a compassionate witness to somebody unpacking their stuff and being able to reframe and being able to understand that strong people get tired. Strong people get angry. Strong people get sad. And that is resilience, right? So when you don't feel like you have any resilience, in fact, you're living with resilience every day as you carry this stuff day to day, and begin hopefully at some point to unpack it and work through it.
Yeah, strong people experience pain. Strong people get sad. Interesting things to hear. Yeah, but it's right. It's safe to break the silence. Let's acknowledge some of that. Now, like Bart, we've already talked about this, we've hit the peak of the crisis. Isn't that correct?
Yeah, far from it. Absolutely, far from it.
Tell us what you see coming and how we might start to prepare ourselves as individuals and or as leaders.
Well, first off, having a forum like this to discuss this, to really plant the seed to start thinking and considering our own mental health, and be what is coming. At the end of the day, we're in the midst of, we have a lot of frontline workers, and I equate it to the Second World War. You have, men and women at the front, fighting and being shot at, and there's an acuity and, a hypersensitivity as to what's going on around us. We have frontline workers, nurses, doctors, PSWs across the board that are on the front line that are going to experience some anxiety and post-traumatic stress disorder. So what's coming, we have no idea. And alluded to it, we're going to see an increase in addictions. We're going to see an increase in abuse. We're going to see an increase, self-harming behaviors on the increase. It's jumped 20% in the past year, right? Grant Mullen the other day said they've seen a 20% increase in the diagnosis of depression. They've seen a 20% increase in prescription antidepressants. And this is just a tip of the iceberg. So from a church perspective, from a humanity perspective, we have to be prepared as to how we're going to offer support for the individuals that we're dealing with that come to us. Here's part of the challenge, right? And I'm speaking from a Hamilton's perspective. I think it would be very similar across the board. That if I get a call from somebody and I want to make a referral, I can make the referral. but the referral is not picked up for 2 months, right? On top of that, that once the referral is picked up, we then contact the person, and our first intake appointment, it may be 4 to 6 months. The first actual in-place appointment can be up to a year, up to a year. You know, I work in crisis. Here's the practicality of what I do. I need help now, not in a year, not in a year. And, you know, the other part of that is that a lot of the people I deal with cannot get a therapist, just for various reasons. They don't have the benefits, they don't have the finances, they don't have. So there's a huge segment of the population that can't get the help they need, you know, to build those relationships, to have that therapy, to discuss the things, the inner child, you know, it's just such a mess. And we as a church, right, and again, this is only where I'm coming from, we as a church have got to offer the support within the congregation and in the community, and to meet the needs of the people that we're supporting. You know, we have to really think outside the box. And what are we going to do? How are we going to help people? So the fact of the matter is, you know, consider this. In Hamilton, in one of the long-term care facilities, 250 people had COVID. Of that 250 people, 40 people died. 40. So to put it in just graphic terms, people were being wheeled out from this facility. I have 3 people in long-term care facilities, personally, right? Both my in-laws and my sister, right? There's an outbreak of COVID. You know, these are the things that people are dealing with on a daily basis. And really, how do we help? How do we support people? You know, at the beginning of COVID, I would tell people, hey, you know what, buck up, we're all in this together, we're going to get through it, you know, hoorah. A year later, you know, those statements are falling far short. Yeah, you know, I don't care that we're in this together, I'm hurting now, right? So, you know, my perspective is we have to be prepared. And a lot of that is building those relationships, being aware of our own mental health, other people's health. You know, I'm a firm believer when if I ask somebody how they're doing, the natural response is fine. My next question is, did you just lie to me? Okay, because I really want to know how you are, right? You know, so, you know, it's about to come, and we have to be prepared.
Yeah. Well, and I've heard you say it before, Bart, and others on this call, it's okay to not be okay.
Absolutely.
Well, yeah. So I'm seeing a lot of questions. I'm seeing a theme start to come in some of the questions, and I'm pushing the questions to the panelists. And one of these themes is just let's get as practical as we can from your position, whether it's as a professional or just as a Christian or as a man or a woman, on a very practical level. What can we do right now? Our regular rhythms are completely broken. Our connectivity is completely broken. We can't go to church. What can you suggest to us panelists that would be very practical, one thing that you can do today to help somebody?
I'd love to jump into that one, Jeremy, because I think, as been said before, this comment that, you know, I've gone to church for years and years and no one's reached out to me. That, I think, is the number one thing that we can do to people is reach out.
Amen.
I was on a Zoom call last week sometime, and during the Zoom call, I felt God give me 30 names of people I needed to reach out to, and just sending them a text. How are you doing? I love that comment that you made, Bart. Is this, you know, are you lying to me? I've often looked people in the eye and said, no, really, how are you doing? Because you're hiding behind a mask.
Yep.
You're putting up a front, and right now, I got to share this. I keep this on my desk. It's the but God card. And I remind myself of that every opportunity I get, how can I steer the but God into the situation? I'm struggling. I understand. And to share, it's okay to struggle, but reach out and be the hope, be the light. And it's okay to say, I don't quite understand everything that you're going through, but I'm here for you. You're not alone.
Mhm, mhm.
Go ahead, Gail.
Yeah, I think that, and I think of pastors around this as well, that, we're all, everybody's struggling. We're all struggling, right? Frontline workers, not frontline workers, people, like, just no matter what you're doing, no matter where you are, everyone is struggling. And I think the idea that, when we're called to care for other people, whether that's just in our personal lives or whether that's in our professional lives, right now, I'm not sure that, to Ruth Ann's point about feet on the ground, I think all we can do is walk alongside, right? And just be with someone in whatever it is they're going through, particularly because most of us are also going through it. And so sometimes just partnering, I mean, it's not about solving the problem. I talk to patients and clients all the time about, this stuff that we have no control over. And that basically is this pandemic. Where is our locus of control? Where's our agency? Well, in what we do. Do we follow protocols? Do we not? Can we just sit with what we're feeling and sit with someone else and what they're feeling and just be together in it, right? So just walking alongside other people, I think is in many ways the most we can do right now.
Mm-hmm. Well, let's make this even more personal. Here's a question. I'm going to read it. I long to see people three-dimensionally, but I find more and more I don't want to make the effort to leave the house or even talk to anyone on the phone. What is my response? The opposite of that which I desire? So this is somebody being very real and transparent, saying, wow, this is pressing in on me. I normally want to do these things, but right now I don't know how to feel. I don't know how to respond. What would you say, panelists?
I think we all relate to that. I think that's an uncomfortable reality that resonates with just about everyone. I've been doing this for not quite 15 years, and something I've been noticing lately, especially even just, since we all packed up our trees and the Christmas decorations went away, and now we just kind of settle in and pray for spring, is I have the same conversation 4 times a day, and it goes exactly like that comment.
True.
I'm still trying to figure out how to come up with a better answer, but for now, what I'm saying is do what you can do. If, it kind of takes us in the direction of how do you treat depression? Well, can you get out of bed? Can you go make a cup of tea? Can you take a shower? All right, can you open the window and stick your head out? Like, what is a reasonable expectation of yourself? And whatever you can do, start with that, focus on what you can control, and start to build some momentum. And probably once you get a little bit of a routine going, then you can start to do a little more. And maybe you can be the person to reach out to that woman that's angry at her church, or maybe you can be the one that can offer a little hope to someone else. And the way we start to help ourselves is by helping other people. But you got to get out of bed.
Yeah, and I would say, just allowing ourselves, giving ourselves permission to just meet ourselves where we are, right? And just to be where we are, and to, I love John Kabat-Zinn's definition of mindfulness, which is to pay attention on purpose in the present moment and without judgment, right? And to begin from there, to begin getting our, letting go of that depressive rumination we do about the past and that anxious rumination we do about the future, because now my hands are tied. I can't do anything right now. I need to loosen my grip and bring my hands back to what can I do now? And maybe that is just get out of bed and have a shower, right? And being kind to ourselves, not being so shaming and so judgmental that we are constantly keeping ourselves down and frozen in this really horrible place. But to be able to say, yeah, you know what? It's okay that I'm not okay right now, right?
I think it's also important to recognize that at various stages in our life, we run on empty, and it's okay. It's okay. It's okay not to be, to give all the time. The wonderful thing about being a giver is that on the other end of the spectrum, there's the receiver. And sometimes during different seasons in our life, we have to receive. My daughter put it into perspective, the old adage, the question, is the cup half full or half empty? The fact of the matter is it has nothing to do with the cup. The fact of the matter is the cup is half full if you're pouring into it. The cup is half empty if you're taking out of it. So there's different seasons in our life in which, we just don't have it to give. And at that time, we need to get support for ourselves to fill our cup back up. We can't run on empty. We can't give what's not there. And I think that it's very important going forward that we even talk about boundaries for ourselves to make sure that we are well and safe, right? From a church, we're notorious for wanting to fix everybody all the time, every situation. And sometimes, we have to recognize it's not our job to fix people. We can only do what we can, and we have to have boundaries. I just want to make a statement, note, this is really personal. There's a doctor in Montreal that died by suicide, and a lot of it was attributed to the fact that she was a frontline worker in the midst of the COVID. Just recently, up in Milton, a nurse killed herself because of the situation as far as COVID is concerned. We really have to recognize, the severity of our situation and really be prepared and offer the support for each other, right? And for those around us. So, it's just one of those things I wanted to highlight.
Well,
I was wondering.
Go ahead.
Yeah, I really appreciate what the panel has been saying. I'm kind of butting in here, but Jeremy, kind of give me permission. One of the things that we haven't talked about that I've been finding, and if I'm finding it, dimes to dollars, most of you are, that is that there is an element of society, you perhaps, who are busier than we have ever been, and working more hours, working harder than we ever have. And it's very difficult. And this is where my guilt sometimes comes in, this sense where I want to be reaching out to the church and to others and doing things. But the reality is I have 6 children, 12 grandchildren, my mom and my elderly mother-in-law who's in a nursing home. At the end of the day, we have to come to the place of saying, I can't do it all. There are a few people that I try and stay in touch with, but taking care of ourselves is so important. Amen. And being able to recognize, okay, where are our boundaries, as Bart said. So I encourage you, because you are probably all part of that working doubly hard. As you listen to Bart and Gail and Will and Brad, there's so much need and we can't do it all, but God. And it's but God for us. Sometimes he tells us, you need to go and rest.
Yeah. There was a situation at St. Joe's Hospital that was very public. The CEO, the advisor to the Ford government, as regarding COVID, decided in his infinite wisdom to get onto his plane, fly down to his private villa down in, I think it was the Dominican, right? And then he decides to fly back and, eventually he resigned. But the message that was received from the frontline workers that are putting in extra hours all day, every day, trying to control this, that had their vacations canceled, right? Is like, what message are you receiving, right? It's just like so discouraging. So and when we talk about self-care, it's so important in establishing boundaries. So.
No, we've, there's such a multiplicity of things that we could get into. And somebody is asking me this question, and it might, I heard Gail say this at one point, many of the introverts are actually feeling a little bit okay because not having to be forced into an extroverted world, but some extroverts are really struggling. So Brad, I think a question had been posed to you, like, what do we do in this extrovert who wants to be out in the world, who wants to leave their home and feeling shamed by society? What feedback? That's a big question, but what kind of feedback do you have for us?
Too. I got into this profession because I like people. I'm someone that gets energized by talking to people, being around people. I'm glad we have Zoom. It's good. It's not as good. I suppose any answer has to be prefaced with, like, don't break the law. Let's try not to get fined. I want everyone to be responsible and to stay safe. I think that there's a lot of truth in what Anne said earlier about news media as contagion of fear. And so something I've been sort of mulling on my own is trying to figure out what's the difference between being responsible and being hysterical. And I think we can all probably come up with our own answers, and I think good people can disagree on how to draw the line in terms of what's safe or not safe. None of us have all the information. So how to be an extrovert? Well, if you have a bubble, if you have people, go get a hug. If you don't have the opportunity for that, be careful out there. But within reason, like, we can still do things that are socially appropriate. You can bundle up and go for a walk outside. You can do other things. I think the only good answer here is we have to play the long game. Someday this will be over. We'll all get vaccinated. COVID will go away. And I think that'll help a lot. I'm going to do a little pivot because I also got another question that kind of goes in the other direction. Someone else messaged me, and I'm going to paraphrase, but it's essentially, I find myself wanting to pull back. I'm not all that interested in reaching out right now, or at least I'm not motivated to. And is that denial? Is that healthy coping? How do you split that hair? Gail was saying earlier, I think a few times today, and I think it's valuable, that we have to approach this with a lot of compassion for each other, but especially for ourselves. Most of us are better at being kind to other people than we are at being kind to ourselves. And whether you just need to stay in bed today because you're depressed and it's a depressed day and maybe it's not the right day to try to go outside, or if you do need to go outside because you just need to find some other humans to talk to, maybe while you're in the lineup for paying for your groceries, it's got to be okay right now, because what else are you going to do? And so is it denial? Could be. I mean, that's probably a half-hour conversation to unpack that, but it is also coping, because as human beings, we adapt to our conditions, we adapt to our circumstances, and right now we're all trying to figure out how to get through this. If you can turn to faith, that's great. If you can turn to family, that's great. If you need to turn inward for a little while, I'm okay with that. And I think we have to make allowances for everyone's experience.
Yeah, I want to frame in. Thank you, Brad. I want to frame in one last question before we get to a personal testimonial of a life changed. And I'm seeing a thread. I'm seeing a little bit of discomfort in some of the comments. And now, look, friends, I don't know where you're from. I don't know where your life journey is all about. I know that faith has really transformed my life. Without faith, I'd probably be much more of a wreck. I have lots of addictive personalities and tendencies and things, and it's because of my faith and other people around me that I've been able to get through that. But look, 2 years ago, I would have been totally ashamed to say, and I regularly am seeing a psychotherapist. There was a huge stigma on that. There was an even much bigger stigma. This is the first time I'm sharing this publicly, that I tried a medication regime for about 16 months and helped me reorient my brain till I could get some healthy patterns and now leave that behind me. There's massive stigma in that. So, but the thread that I'm seeing is there's questions about, yeah, you guys are talking faith. Psychotherapy must somehow be against faith or different than faith or outside of faith, intention to faith. No. Compassionately, somebody give me your thoughts on faith and therapy, and everybody's going to want to talk. Go ahead, panelists.
I think one big thing we need to realize is that we all have our strengths, and I realize I also have my weakness, and I know I don't admit that very often, but we all have our strengths and weaknesses, and we need to work together as a team. And I think if as a society we learn that we can all help, there are some deep underlying things that I might not be able to work someone through. I have a huge passion for nutrition, and I can walk someone through faith. But if they're lacking certain things in nutrition, or if they're not exercising or getting out there at all, getting their energy out, I might only be able to go so far. If there are some really deep things, then go see a psychotherapist. But let's work together as a team, because we're all interested in leading people to a better life. And I think that's a big part of what we need to do.
One of the things that I agree with Will, that for me, part of my not my dissertation, but my education is philosophy of professional counseling. And so I actually wrote a book in 2016 called Deep Impact, and it's dealing with integrating theology and psychology. So it actually answers some of the questions that you're asking. I mean, it's not a be all and end all. Every single chapter could be another book, but we need to begin to look at God has given us giftings in all kinds of realms, and can we integrate then our belief and what God is doing and still be, absolutely sold out to Jesus and be able to treat people. I think we have to be careful what methods we use. Absolutely. We don't want to get into strange things, but most psychiatrists and psychologists aren't into strange things. I mean, we really want to see people well. So anyways, that's my 2 cents worth. It's integrating.
My response is that if you want to see the best book on psychiatry and therapy, look at the Bible. It is the original book on cognitive behavior therapy. Change the way you think, change your behavior, right? 40 years ago, somebody said, hey, let's come up with cognitive behavior therapy. It's been around for over 2,000 years.
Yeah. I can also say that if we're not sort of encouraged to include faith in our conversations with patients and clients, if it's an important part of somebody's life, then I think it's irresponsible to ignore it. I think that it being, as we all know, immensely healing and helpful. I also know that as a therapist, there are lots of times when brilliant things come out of my mouth, and where they came from God, because they were not something that I thought through and said. It just it feels like it comes through me lots of times. And so that's my faith that God with me in this work, that I'm not in it alone, that he walks with me in it, and that he is in ways maybe in the room with me when I'm trying to help his people, just heal and feel better.
I'll be super quick. I went to seminary to get my counseling degree. I don't see any inherent contradiction. I would make an argument that psychotherapy is ministry. Fundamentally, it's just two people talking, trying to connect, trying to have a relationship. It's my way of trying to love people. And I'll leave it at that.
Thanks, Brad. Now, Pastor Ken, he's the president of this organization, Anchor Ministerial Fellowship. He'd like to jump in. Pastor Ken, you have some thoughts for us?
Yeah, I think there's no contention, as Brad said, between the two. I think I think Ann said, what we think about the circumstances we're going through will determine the length of your mental distress, or something along that line. And so it's how we think. And hope is the confident expectation that things are going to get better. And the only way that we can have a confident expectation that things are going to get better is when we hope in God. And so they go together. It's just that the basis of our talking to people to encourage people to have hope is deeper than, well, I hope things work out. I hope you can handle this. I hope you can do that. We come back to say we hope in God. And he said he's going to make all things new. And to me, the excitement during COVID is that it's accelerated us to new things. And I think the mindset, if we could help people to see don't think about what you can't do, think about what you can do. And God is in this, and he's breaking us out of old routines, and he wants us to have new routines, and all the things that have been mentioned here, which I thought was really good. Check in with people, build relationships with people, support people. And someone even mentioned, I think it was Anne, about setting financial budgets so that we can help people get support. And so I think the psychotherapy is people that will sit down and give people hope in God. It's not just a hope in the therapy, it's a hope in God. And so I've been excited about this morning. I think we should look and shift our attitude to what good things are coming out of this, and it helps us overcome the dark things. So I'll leave it at that.
Yeah, that's awesome. And we're going to end off with one of my really best friends in life, Brody Haight. He's going to speak exactly to some of these things we've been talking about at the end here. Brody just is a great shining example of a life of transformation, having gone through everything that we've been talking about and gaining some victory. So Brody, tie a very personal element on this. What has been your journey in mental health and into victory?
Yeah, I'm so excited to be here. And I came on this call just so eagerly learning from you all. I took so many cool notes from this call, and my wife also, she's over here hiding. Yeah, so part of my journey is I've experienced mental illness from a young age, depression, suicidal thoughts, anxiety, and Anne said fear. Fear is one of the roots, right? I was writing down here when she talked about fear, that we feed our pain. And that really resonated with me, because from a young age, I started to feed my pain with chemical dependency, cocaine from the age of grade 8. And then so many different things to feed that suffering that I was experiencing. I didn't know a way to get out of that suffering. So that was 15 years of addiction to cocaine, in and out of institutions and jails. And yeah, it was a very humbling experience to go through all of those things. But it did take me to the end of myself, to a suicide attempt, where while I was laying in the hospital, I just woke up one day, and I woke up to the concept of God. He just radically changed my life and brought so much hope to me. And that's why I'm able to sit here today, giggling and smiling, because I realized I wasn't any of those things, and I was totally set free. When Jeremy asked me to come on this call, he said, "What would you say?" And one of the things that really stuck with me was what Ken actually just said. Encouraging with the hope of God, and bringing an encouraging word. And the verse that came to me was in Proverbs, when it talks about the tongue has power of life and death, and how powerful an encouraging word can be from God. Not only even in encouraging word, just in general, how powerful that can be. I spent a lot of times getting arrested in my life, and all of the times in my life in this journey, I can remember those encouraging words. One time I was sitting in a police station, and the police officer was showing me a videotape and some things of myself. And he just asked me, "Why, Brody? You are so much better than this." And he started calling out these encouraging words over me, saying, "You need to find another way. This is not you." And he started speaking things about my identity over me. And I remember that like yesterday, sitting in that room. Not only the police officer, but in past relationships, when somebody would speak about my addiction and they would encourage me to try another path in life, that God had bigger things for me than this. I remember encouraging words from my family members that would sit down with me and give me unconditional love and listen and bear my burdens. And they would speak life and encouraging words of hope over me. All of those words, it just looking back brought me such hope, even though in the time I wasn't receiving it or couldn't really understand it. because anybody on this call that has experienced depression or dark loneliness, when somebody says an encouraging word of hope, you don't really want to receive it, because you can't receive it because it is so dark. But I was able to receive those things deeper down inside of me at those times. So I just think how powerful it is, while we're out, to speak and being a voice of encouragement and a voice of hope. There's so many things in the Bible and words that God gives us that we can speak over people, that are so powerful. So I just thank you guys. I've learned so much today from all of the panelists and from people speaking on this call from different perspectives. And I'm learning also during this time, and Deidre, how we can make it through this time. We get so many emails and calls and parents from people battling chemical dependency. And God has opened some incredible doors to share testimonies, because we all have such a unique testimony of things that we've overcome. And it's powerful right now to use our story to share with others how we're coping, how we're making it through things, and the hope that God is bringing us right now to make it through these times as we go through. I thank you, Anne, for sharing about the grieving. I realized that I was going through grieving right now, and that collectively in the world that we're going through grieving together. That was a really good thing in the slide in realization about, we're not able to be with our families during Christmas, and Deidre hasn't been able to see her grandma, and my dad is in St. Joe's and he has dementia, and I haven't been able to see my dad. I've only seen him a couple times on Zoom, and that's been really hard on me. So it's a really, really good thing to reflect on the things that we're all going through during this time. And to think that it's not affecting us could be a very unhealthy place to be. So thank you for bringing light to bring reflection to all of us. And thank you, Jeremy, for just bringing this all together. It's been amazing.
Right on. My pleasure. And you'll like this quote from a direct message. Brody, if you have not done so, please write a book on your journey and on the hope of Christ and the power of encouraging words. I love it. I love it. Right on. Now, I put in the chat, friends, my email address. You can email me, jeremy.dorten@anchorministerial.org. For any ideas, I'm going to give you a timeline, though. You only have the next, say, 2 hours. If you have books that have deeply impacted you on mental health, or online resources, or therapists, you name it, whatever. I would love to amalgamate all of your thoughts. I've already got a couple dozen resources from the panelists, and I'm going to then put that all together, and I'm going to send that out to all of the registrants from today's call. Friends, keep on keeping on. That's a phrase I've used my whole life. Keep on keeping on. Reach out to people, talk to them, be, if you're of faith, be Jesus with skin on, even if it's through Zoom. So thank you again. Thank you in particular to each of the speakers and the panelists, and Brody for giving his personal testimony at the end. Evidently, we could talk a whole lot more. Would you agree? Yeah. There's a whole lot more that could be said. But again, on behalf of Anchor Ministerial Fellowship and all of those on this call, thank you so much for joining us, and blessings on you. Have a great day.